I want you to imagine this scenario. You're driving down the street and somebody pulls up to you on the side, roll down the window and says, "Hey, your taillights aren't working." What do? Do you take your car to a mechanic or do you take it to a taillight specialist who just specializes in taillights? Come on, we all know we're going to take it to the mechanic. And what does he do? Does he just look at the taillights or does he check out all the wiring and check out the fuse box and even check out the mechanism that you could switch your lights on and off? He looks at the whole thing. Well, here we have this medical model. And it is very simple. You go to your specialist and you have a problem. And you go to your generalist, your general practitioner, you have a problem, and then he sends you off to your specialist. And you might go to ear, nose, and throat doctor if you have an ear, nose, and throat problem. You might go to a hand specialist if you have a hand problem. We send to a cardiologist, respiratory specialist, podiatrist if you're suffering from foot problems. So the medical model has broken you, the patient sitting out there, into little pieces and has sent you off into different departments. It might work sometime, but as a whole, it's not a really great way to approach health because health doesn't just happen in the hand or the foot, it happens in the whole. Chiropractic is a vitalistic approach, where we look at you as a whole. We're looking at your whole body, how it communicates, how it's a relationship from the left side to the right side to the body, from the top half to the bottom. As a whole, how are you functioning? Are you healthy? Is everything working at 100%? Rather than treating your hand, rather than treating your foot, rather than treating your heart with some heavy-duty toxic chemicals. So you might be out there taking some medication for asthma. Well, did you know as you're taking this medication for asthma, you're stressing out certain organs? You might be helping the lung, but you're stressing out certain organs in your body. I see people coming into my office, new patients all the time. They get Vicodin and muscle relaxers. Some of you guys are sitting out there right now with this in your purse or in your pocket. Well, let me tell you, how does that pill, how does that muscle relaxer know where to go? Maybe you're suffering from low back pain. Well, let me tell you, did you know that your heart is a muscle? Did you know that your lungs are encased in muscle, and if they don't work, you can't breathe? So most people overlook these facts, that something like a muscle relaxer could actually cause some severe damage on the side. That's why chiropractic is so amazing. Not only are we not using the medicine and we're keeping you away from drugs, we're looking at your body as a whole. Same thing happens in food these days. They put in vitamin D and they take out all the nutrition out of the food and put in a couple of vitamins, synthetic. Do you think that's working for your body? I want you to really take that in mind. We want a whole food approach. We want a whole body approach. And that's why chiropractic is one of the leading professions in getting people healthy and functioning again, because we take a look at everything. So next time something's going on, and actually we had a patient in here just a little bit ago. She came here suffering from what was diagnosed as carpal tunnel syndrome. She had already had 2 surgeries on each hand that were a failure. She had lost more range of motion that she began with. Okay, so she went to her general, sent her to the hand specialist. The hand specialist sent her to the surgeon. They did all their work. 0 results. So what was missing? Again, they didn't take a look at the person as a whole. They just treated the hand. We can't do that. If we want ourselves and our families to be healthier, we can't just treat the symptom. We got to take a look at the whole. We got to kind of attack the cause. That's why chiropractors focus on correcting the vertebral subluxation. And by correcting the vertebral subluxation, we look at everything in the nerve system. So that patient, we took an x-ray, we noticed that there was total spinal decay in the cervical area. That means those vertebrae were compressed and they were causing numbness in the hands. And nobody ever in the medical model took the time to look at the whole. They just kept treating the hand. No results. Just a few weeks of care, the pins and needles started to diminish. A couple of months later, we had just barely some sensations in the fingers. Why? Is that what we treated? Absolutely not. What we did is we took that person and we wanted the entire body to function. And I knew, and all chiropractors know, when the body could function better, certain side effects go away, like numbness in the hand. It's not a problem. It's a side effect of something else not working properly. So I recommend that you speak to your chiropractor and get your families in here, and instead of taking that mechanistic approach that we've been trained and educated with our whole lives, to start looking at a whole vitalistic approach. How you eat in your home is very important. How you take care of your body in your home is very important. And if you allow your chiropractor to start taking care of these components, to start aligning your spine, correcting that vertebral subluxation, you're going to live a better life knowing that your body's working. The whole thing, not just the spine, not just your back, not just your neck, but your organs, your heart, your liver. Everything is functioning. Now, I can't even feel my liver, but knowing that I got checked yesterday by my chiropractor, he guaranteed that it's functioning at the best possible level that he can. Not only my liver, but every organ in my body, every cell is functioning better with chiropractic care. So you have a choice. We all do. Every day we have a choice. Mechanistic or vitalistic. We make that decision in how we buy our food, and we make that decision on how we take care of ourselves. So if you know somebody out there that's suffering, and they've been going from doctor to doctor to doctor, from this specialist to, we all know that. Listen, my mom, she suffered through all that. Nobody told us about chiropractic care back then. I didn't know what was going on. She suffered a lot. And if I can help prevent that suffering in somebody else, I'm committed to. Your chiropractor's committed to that. So we want to take a look and create whole. She went to all the specialists. Nobody had an answer. The top specialist, no answer. Great guesses. We can't have health with guesses. We need to be right on about your health. So if there's something in this message that you heard, talk to your doctor about it. Talk to the chiropractor right in your office and let him know how he can help you live a better life so we can create a better community and a better world.